Welcome to Turning Policy into Practice, Implementation Guides for Overdose Prevention and Harm Reduction. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague Jeff Bornstein. Today's web forum is sponsored by the National Overdose Prevention Network, a program of PHI Center for Health, Leadership, and Impact, and produced by Dialogue for Health. Now let's meet the moderator of today's event, Matthew Marsom. As Chief Programs, Policy, and Government Relations Officer for the Public Health Institute, Matthew works to advance and support the work of the organization's domestic and global health programs, identifying opportunities to strengthen program impact and promote cross-program collaboration. Matthew was also responsible for designing and implementing strategy for monitoring and influencing public policy, legislation, and regulations affecting PHI projects and public health policy relevant to PHI interest. Welcome, Matthew.
Thank you so much, Marlene, and thank you to everyone who's joining us today, wherever you may be located for this webinar on this really important topic. And I'm so grateful that we have our colleagues here from ChangeLab Solutions to introduce two essential policy guides in this web forum. One offering 11 evidence-based strategies at the state, local, and institutional level, and the other created in partnership with the Network for Public Health Law, providing guidance on the policymaking process for effective and equitable implementation. We're hoping today that you'll have an opportunity learning about these guides to discover how these resources can support your work in the field of advancing policy change to address community needs wherever you're located. We have an audience joining us from all different locations, and we're going to have an opportunity shortly to find out more about that. But we're hoping today in these objectives that you'll be introduced to these policy guides from ChangeLab Solutions and understand how these tools can be used to navigate policy process for implementing state and local overdose prevention policies. And you'll be provided with specific examples on how these policies can be put into practice in state and local jurisdictions. It's my pleasure to introduce Liz Olson, a senior policy analyst at ChangeLab Solutions. Liz works to address the structural drivers of health inequities across several program areas, including behavioral health, child and family well-being, and income support. Prior to joining ChangeLab Solutions, Liz spent 3 years at the Washington State Budget and Policy Center, where she worked to advance more economically just state budget and tax policy. In this capacity, she conducted research, built coalitions, and developed and advanced legislation to strengthen the social safety net and improve support for people experiencing poverty. Liz started her career in direct service, working alongside survivors in intimate partner violence and families experiencing homelessness and housing instability. Thank you, Liz, for joining us, and we look forward to your remarks shortly. And our next presenter, Christine Camilleri, also joining us from ChangeLab Solutions, where she serves as a senior planner. Christine engages with programs and projects that focus on the intersection between policy, the built environment, and health equity. Prior to joining ChangeLab Solutions, Christine worked at the New York City Department of City Planning, where her work centered on climate resiliency, community-based planning and outreach, environmental review, and zoning and land use. Christine also worked in post-disaster recovery during New York City recovery from Hurricane Sandy and in affordable housing and preservation. In addition to her planning and policy endeavors, Christine's vocational life, including a full spectrum doula and volunteer work in harm reduction in Philadelphia, where she currently lives. So really grateful again, Christine, for you joining us, and Liz as well. So pleased to have your expertise sharing these important resources.
Thank you so much, Matthew, for that lovely introduction. And thank you for having us today. We're really honored to join you all and excited to share about the resources that we've recently developed at ChangeLab Solutions, and really hope that they'll be useful to folks in the field. Before we start, I want to name that we know that there is an incredible amount of expertise in this virtual room, and we want to name that Christine and I really consider ourselves learners and not experts in this work. So again, we're really honored to join you and are looking forward to engaging in conversation with you all, learning from the insights you might be willing to share with us. I know a webinar format isn't always a conversation, but we do want to invite continued engagement after this presentation if this work feels like it resonates with you and you want to connect with us further. Okay, so before we get started, I also want to acknowledge that our policy and implementation guides were supported by funding from the Centers for Disease Control and Prevention. the content of those guides and of our presentation today does not necessarily represent the official views of CDC or the U.S. Department of Health and Human Services. I should also note that while neither Christine nor I are attorneys, many of our colleagues went to law school, including folks who worked on this project. So just want to note that the information provided in this discussion is for informational purposes only and doesn't constitute legal advice. We can move to the next slide, please. Thank you. So for those who may not know us, ChangeLab Solutions is a nonpartisan, nonprofit organization that uses the tools of law and policy to advance health equity. We partner with communities across the nation to improve health and opportunity by changing harmful laws, policies, and systems. Our interdisciplinary team works with community organizations, governments, and local institutions to design and implement equitable, practical policy solutions to complex health challenges. We can move to the next slide, please. Thank you. So today, we are excited to share 2 resources that ChangeLab launched this summer that highlight state and local policy strategies to reduce overdose and other drug-related harms. In addition to the funding support from CDC that I just mentioned, these resources were also developed in partnership with the Network for Public Health Law's Harm Reduction Legal Project. So we want to just acknowledge the incredible contributions of our colleagues at the network for their support on this. The policy guide, pictured on the left of this slide, highlights a range of state and local policy strategies, outlining the details of potential options for new policy or changes to existing policy to help prevent overdoses. The implementation resource, which is pictured on the right, offers guidance on the policy process and aims to support readers to put those strategies into practice on the ground. So a helpful way to think about the 2 companion resources is that the policy guide is sort of the what, and the implementation resource is intended to help you think through the how. They're both now available on the ChangeLab Solutions website, and it looks like that link was just shared in the chat. So thank you for dropping that. On the next slide, I'll share just a bit of context on how both of these resources were developed. So our team used a couple of different methods to identify the strategies that are outlined in the documents, including an initial scan of peer-reviewed and gray literature to identify existing overdose prevention policies implemented in 4 focus sectors, which for this work were healthcare, criminal legal, schools, and community. We also conducted interviews with 22 experts across those sectors who work in a diversity of state and local contexts, including as researchers, healthcare providers, policymakers, community-based organization and government agency staff, and policy experts and advocates. Many of our interviewees also shared their perspectives with us as people with lived experience, and we are extremely grateful to each of them for sharing their perspective and expertise with us, and their insights are really foundational to the resources that we've developed. Finally, we conducted an assessment to screen policies across a range of impact and feasibility criteria like strength of evidence, ability to advance equity, and that assessment helped us to generate the final group of strategies that are highlighted in the guides. So with that sort of bit of intro, I'm going to pass it over to Christine, who will share more about our approach and what you can find in the resources.
Thank you so much, Liz, and it's wonderful to be here with everyone today. And so I'm going to talk a bit about the drivers of health inequity, which really informs a lot of how we approach our work at ChangeLab Solutions. We believe at the organization that laws and policies that have perpetuated racism, discrimination, and segregation throughout our nation's history have had and continue to have a profound impact on health and well-being. And so overall, our work focuses on addressing what we call these fundamental drivers of health inequity. These include structural discrimination and racism, income inequality, disparities in opportunity and political power, as well as governance that limits meaningful participation. And we view these all as forces that create inequity and widen existing disparities. And so to connect these drivers to this work that we're here to talk about today specifically, we know that overdose trends are directly tied to a long history of legal and policy measures that have been enacted in response to drug use, and that these laws and policies continue to drive equitable outcomes. And so what I'm talking about here more specifically are policy decisions that have invested in an expanded criminal enforcement, arrest, incarceration, and other punitive measures that are not associated with lower rates of drug usage and that have unfortunately continued to exacerbate health harms and have done so historically. And so also, in addition to that, while drug-related harms are increasing in every segment of the population in all parts of the country, they are characterized also by deepening inequities across race, income, and socioeconomic status and geography. And so I think the point that we want you to kind of hold on to as Liz and I move throughout the session today and as we move into Q&A is that if laws and policies are part of the problem, they have to be part of the solutions. Next slide, please. And so Liz spoke a little bit about the policy guide. Again, that's the document that you can really think of as the what in all of this. And so I want to just kind of briefly review the sorts of laws and policies that are captured in that document and detailed there. And just a note, we ended up organizing these policy strategies into two basic buckets, which kind of coincide with the strength of evidence. And so the first of those buckets is what you see here, which are laws and policies that we consider to have a well-established evidence base. So these are laws and policies that have been implemented in multiple states and or local jurisdictions across the United States. Some examples you see here include expanding access to medications for opioid use disorder, increasing access to naloxone, strengthening overdose Good Samaritan laws, which for anyone who's unfamiliar are laws that provide legal protections for people who seek emergency care in the event of an overdose by providing immunity from arrest, charges, and or prosecution for drug-related offenses. We also include in this bucket authorizing and expanding syringe services, examining policies related to Medicaid and enrollment assistance, as well as efforts to strengthen behavioral health supports for youth populations. And so moving to the next slide, we also have a second bucket of policies that are detailed in the policy guide that are considered more new or emerging. And they have a little bit of a more limited evidence base in the United States context. In many cases, this is because of existing legal challenges to their implementation, but these are still policies that show a lot of promise. And so we still wanted to really explore them and provide information about them and want to speak about them today. And these emerging strategies include removing barriers to fentanyl test strips as well as other sorts of drug checking equipment, overdose prevention centers, which I'll talk more about in a few slides, examining policies that criminalize people who use drugs, moving towards removing criminal penalties for possession and or drug distribution. This includes supporting housing first, which is an policy approach to connect people who are unhoused with housing first, providing supportive services second without requiring sobriety or abstinence from drug use to access that housing. And this also includes improving and expanding income supports. And so really looking at things like guaranteed basic income, as well as eliminating bans on people with prior felony drug convictions, ending drug screening requirements to access public benefit programs, and more. And so I'm moving through these very quickly. These are all very big policies with, we could probably have a whole session on any one of these. And I just want to mention, these are, again, detailed in the guide. And so encourage you to explore that if you're interested in learning more. Liz and I will also move through some examples in detail and touch on many of these today. And so moving to the next slide, as Liz mentioned, while the policy guide outlines the details of the policy options themselves, the policy selection and implementation resource really contains information on the policy process, and again, is a companion resource to the other one. And so this is a document that is intended to help readers pursue and implement overdose prevention policies that respond to their community's needs, and it shares guidance for translating intention into enacted policy. And so we have a graphic here just in case anyone is kind of newer to the policy process. And so when we say that, is wondering, what does that really mean? This is an example, of what that could look like. It generally isn't a one size fits all, nor is it linear, but just to give you a little bit of a sense of the steps in that. Each of the steps of this process are what are detailed in the policy implementation resource. But the thing I really want to kind of zoom into and really underscore here is how at every stage, people who use drugs, as well as other partners who are directly impacted by proposed policy changes, should be involved and engaged in meaningful and proactive ways. This is something that our key informants really heavily emphasized in almost every single conversation we had that informed the development of these guides. And this is really, really critical here. And so we'll talk more about that. Moving to the next slide. I want to also emphasize that policy change takes a ton of forms, everything from federal or state statutes and regulations, or local ordinances that codify a government policy, to internal organizational personnel policies that may memorialize a change in how an institution operates. And so we have here kind of an illustration of examples of what we mean when we say policy. And so everything from zoning laws to an individual's hospital policy an individual hospital's policy may be fair game here, and all of these can be leveraged to advance harm reduction. Of course, not every policy change is equal in terms of effectiveness, strength, or reach, but there is we're talking about a very big umbrella of policies here. And I want to also note that depending on your role in this policy space, you may or may not feel like you have a lot of influence over policy change. And I want to invite you to consider today that even if that, your role in this isn't super clear and obvious, that if you're here today, you have a role to play in that, whether it's showing up at a public hearing or influencing, really being really deeply involved in the design of a policy. We really hope this training and these resources can help equip you with the information you need. And while our resources focus on state and local policy changes, I also want to emphasize that in communities where significant entrenched opposition to changing drug laws currently exists, there are likely other opportunities to engage in policy change at the organizational or institutional levels. And these, while they may be more incremental, can make really immediate material difference in the lives of people who use drugs and help build momentum towards more transformative change. And so those are also really important. And so moving to the next slide, with all that said, Liz and I are going to move into sharing some examples of some of the policies that are detailed in the guides, to share some information and also to give you a sense of the types of information that you can find more about in these resources. And so I think we have quite a good amount of expertise in this space today, as Liz mentioned earlier. And I think Liz and I are both incredibly grateful to have the opportunity to share information with you and also learn from you. And so we may describe some policies that many of you are very familiar with already. And if that's the case, just know that we're sharing this information in the interests of really just making sure we are all coming to this conversation from the same place. And so that said, on the next slide, I will start with talking a bit about overdose prevention centers, or OPCs. And so these are healthcare or community-based facilities in which people can consume drugs that have been obtained elsewhere in a monitored setting, where trained staff can intervene immediately in the event of an overdose. And so a little more information about what OPCs are and what they typically involve. They can offer additional services and harm reduction measures, including sterile equipment, offer overdose prevention education, naloxone distribution and training. They can have equipment to test substances for the presence of dangerous adulterants, and offer referrals to drug treatment as requested, and may have other supportive services to help meet people's basic needs. And so something that we came across in the literature is evidence that suggests OPCs may be especially effective for reducing overdose risk among people who use drugs and who are also unhoused. And this is in part because public drug use is associated with heightened risk of interactions with the police, harassment, robbery, and just kind of overall compounded stigmatization, all of which can combine to lead to rushed and unsafe levels of drug use and heightened risk of overdose. On the next slide, I want to share a few notes about implementation more specifically. And so taking a closer look at that, we identified in our research that OPCs are a promising policy option, and also the experts we interviewed for this guide pointed this out. At the same time, they are not federally allowable, even though a lot of international evidence and evidence coming out of New York City, where the first two overdose prevention centers were opened in 2021, the numbers are staggering and really show the effectiveness of these facilities. Federal law technically does not permit these. Does not permit OPCs. And so despite these legal hurdles, some states and local jurisdictions have explored pathways for moving forward with authorizing them. And actually in July of 2021, Rhode Island became the first state to enact state level legislation authorizing OPCs. And they have been reporting they anticipate their first site will open in 2025. And again, as I mentioned, 2 overdose prevention centers have existed in New York City since 2021. An early evaluation in July of 2023 reported that staff had intervened in over 1,000 overdoses since launching, and to date, I believe no deaths have been reported. And so just a few other implementation notes on OPCs. It is very important for them to be tailored to meeting the specific needs of that align with whatever the given drug use trends are in a particular area. And so these are not centers that are necessarily going to look the same everywhere. And so again, this is a place where it's very important, as in all of these policies, to engage people who use drugs, as well as folks working directly with people who use drugs in harm reduction, to determine what those needs are and how to meet them. And these are also needs that may be dynamic and change over time as drug trends change. And so with that, I'm going to turn it over to Liz to talk a bit about Medicaid on the next slide.
Thanks, Christine. So the second strategy that we wanted to spotlight today is examining policies related to Medicaid. So there's a really robust body of research that suggests that expanding Medicaid, so extending health insurance coverage to adults under 65 with incomes up to 138% of the federal poverty level, not only improves health outcomes really broadly across the population, but is also associated with reductions in the uninsured rate among people with substance use disorders, increased access to MOUD, increased rates of naloxone dispensing, and decreased overdose mortality. So aside from just adopting expansion, states can leverage Medicaid to improve access to care for people who use drugs in a number of other ways, including by providing Medicaid outreach and enrollment assistance to people facing heightened risk of overdose, like people preparing for release from prisons and jails, by reducing barriers to MOUD and other evidence-based substance use disorder care, by eliminating barriers like prior authorization requirements, step therapy requirements, or quantity limits, and by seeking Section 1115 demonstration waivers to cover services that support treatment and recovery, like supportive housing or peer coaching and support, and by extending postpartum coverage from just 60 days to 12 months to ensure that birthing parents don't lose their Medicaid coverage while they're navigating a major life transition in their family lives and face a higher risk of overdose. Some of these strategies can be employed even if a state hasn't yet adopted expansion. So for folks in states where there's significant political opposition to expanding Medicaid, there may still be opportunities to leverage waivers or other flexibilities to increase access to health coverage for people who use drugs. And on the next slide, the kind of example and practice that we wanted to share or highlight is Washington State's work. So Washington has enacted a suite of policies that work together to improve access to Apple Health, which is their state Medicaid program, and improve continuity of care for people who are being released from incarceration. And we know that that group of people faces dramatically increased overdose risk during their reentry period when folks may have diminished physical tolerance or confront a changed and more dangerous and potent drug supply. So in 2017, Washington adopted legislation directing the state Medicaid agency to suspend rather than terminate Apple Health coverage for individuals in jails and prisons. And that means that people who are enrolled in Apple Health prior to incarceration maintain their eligibility and then have full coverage automatically restored upon release. Most recently, Washington has leveraged a Section 1115 waiver to extend limited Medicaid coverage up to 90 days prior to release, partially waiving the federal rules that prohibit Medicaid from paying for medical services for people who are incarcerated. Those new benefits will take effect next summer, and they'll cover select services, including MOUD. The other actions that I'll mention that Washington State has taken is that the Department of Corrections and some local jails provide enrollment assistance for individuals who didn't have Apple Health coverage prior to their incarceration. And the state has enacted a statute that requires the Medicaid agency to expedite eligibility determinations for some individuals with mental health challenges who are being released from confinement. And that's really critical to ensuring that people can connect with community-based treatment providers as soon as they exit to avoid gaps in care. So I'm going to pass it back to Christine for our next example.
Thank you, Liz. And on the next slide, I will talk a bit about drug checking equipment, which includes, but is not limited to, xylazine and fentanyl test strips, which are really critical tools for preventing overdose because they can detect the presence of adulterants in cocaine, methamphetamine, heroin, and many other drugs in most of the forms that they come in, including pills, powders, or injectables. Both types of testing strips that I just mentioned are disposable, single use, and can be used by people who use drugs anywhere they are consuming them. There are other types of drug checking equipment like infrared spectrometry that can check substances for a broader range of adulterants. Those typically have to be performed on site at facilities like overdose prevention centers with technicians who are trained to analyze the result. And on the next slide, just to touch on how this strategy is being used in a policy context and some of the legal challenges. Drug paraphernalia laws are, as many of you may have heard, commonly impose criminal penalties on the possession of all manner of objects used to ingest or distribute illegal drugs. And in some cases, depending on how those laws are written, it can include equipment that is used to test the purity or potency of illicit drugs like test strips. Criminalizing testing equipment and test strips can obviously really restrict effective harm reduction strategies. And so just to share an example of how Pennsylvania addressed this through a policy change in 2023, Act 111 was implemented to decriminalize drug testing products, including fentanyl test strips. And the law removed FTS and other drug checking technologies from the definition of drug paraphernalia in the state's Controlled Substance, Drug, Device, and Cosmetic Act. And so under the new law, people in Pennsylvania who buy or carry drug checking equipment no longer face criminal charges for possession of paraphernalia. And so this change, is really important. It increases legal access to drug checking equipment for everyone, including harm reduction organizations and people who use drugs and other entities, that want to more broadly distribute drug tracking equipment to anyone at risk of overdose. And so with that, I'm going to pass it up to Liz to talk through naloxone access and move us into Q&A.
Thanks, Christine. So on the next slide, the last strategy that we'll spotlight today is around increasing access to naloxone. So naloxone, of course, remains absolutely central to overdose prevention and harm reduction work. And while there has been some good progress in state and federal and state level policy change to promote better access, including by making some forms of naloxone available over the counter, communities still have not reached the level of saturation that's needed to make sure naloxone is available to every person and in every place it's needed. So states and localities can move towards reaching that saturation by enacting policy to invest in low barrier distribution methods that are tailored to reach people at highest risk of overdose, like naloxone vending machines in carceral facilities or in community-based organizations that provide services to folks who are unhoused, by mandating access in schools, which I'll talk more about in a moment, and by working to reduce the cost of naloxone through programs like copayment assistance that help cover out-of-pocket costs. So one example of a community that's working on this in the next slide is in Maryland. So Maryland is one of a handful of states that has enacted a state law that requires all public schools to store naloxone or other opioid overdose reversal medication on their premises, and requires each county board to establish a policy authorizing school nurses or other school personnel to administer that medication to anyone on school property who's believed to be experiencing an overdose. Building upon the foundation of that state law, the Montgomery County School District enacted a policy just last year that explicitly permits students to carry naloxone themselves. And this was established in response to student organizing. Students had been advocating for guidelines that clearly affirmed that students themselves, not just school personnel, have the right to carry naloxone and intervene in the event of an overdose. So in a discussion that we had with the district's medical officer, Dr. Patricia Kapunen, on another webinar, and we'll drop the link to that recording in case folks are interested in that conversation. She explained that while students were protected under the existing Good Samaritan law and wouldn't have been punished for possessing naloxone, students found the policy, which really focused on adult school personnel, to be unclear about their role and potential consequences. So I think the district's response, I think, is a good example of centering students' needs in designing an naloxone access policy that really eliminated ambiguity and codified their right to carry naloxone. So that is one kind of institutional level example that we wanted to share with you all today. So to close us out, thank you. So there's a lot more information in the guides, more specific detail on each of the strategies, the couple that we spotlighted today, and then many others that are included. As we close, I also want to emphasize, something that Christine named earlier that we hope is a core takeaway from this work, right? Just as law and policy decisions have played a central role in fueling the overdose crisis, they can also be leveraged to help end it and to prioritize care over punishment for people who use drugs. Harm reductionists, community-based organizations, people who use drugs themselves. Many of you who are in this room have long led the way in building grassroots infrastructure that saves lives. And state and local decision makers can really follow that lead by removing legal and policy barriers to harm reduction, by investing in evidence-based solutions, and by collaborating with community partners to ensure that people with lived and living experience have the opportunity to meaningfully shape the policy agenda and inform the ways in which policies are designed and implemented. So with that, I will maybe pass it back to Matthew and we'll move into Q&A.
Thank you so much, Liz, and thank you so much to Christine as well, and those fantastic remarks that both of you shared, and those very specific and concrete examples. And I just want to note a couple of comments. First, that you underscored that everyone has a role to play, and as we reflect on the role that public health, our partners in healthcare, community-based organizations and institutions all have a role to play in this critical area. And also recognizing, as Christine shared, that policy change happens at different levels, and recognizing across the United States, there may be communities where making policy change within state policy or in municipalities can be challenging, but there may be more opportunities within institutional change that can happen incrementally, ultimately before more transformational change will happen. And it's really about recognizing the depth of that engagement across different levels. We do now want to move to the Q&A, as was referenced, and I want to encourage, we've had a couple of comments and questions that have come in through the Q&A. So please use the Q&A feature to send in your questions for Christine and Liz, and we'll have an opportunity to facilitate that Q&A now. And I want to start out with a question, and either of you can take this one, Liz or Christine, which is, what recommendations do you have for our audience who are new to the policy process? If you remember at the start, when we looked at the poll, we had some folks who were, I think, in the dark was the way the poll question was framed, and there's other folks who are would reflect that they're perhaps more expert in this area. So what advice would you have for those who are new in the policy process and where they might get started?
I'm happy to start, and Liz, I'm going to invite Liz to fill in the gaps. I think, one of the most important things, an important place to start, I think, would be taking steps to understand who is already working in this space, in where you live locally, or whatever level you're seeking to be involved in affecting policy change at. And again, I think we keep repeating this because it's really important. I think understanding the most critical advocates in this space tend to be people with living and lived experience and harm reductionists doing this work. So I would personally start there, in identifying allies and building power through partnerships with others. And I think also taking a look at, really thinking critically about what levers you personally can affect, and building out those partnerships from there, learning from folks who are leading that work. And so I think something I want to mention here, we've been talking a lot about how it is a lot of people in direct service who have been leading this charge. And I think we've been talking about partnerships and building power. I also think that is really important for addressing the reality of burnout being a very, very much a reality in this space. And so making sure folks are complementing each other's efforts, and supporting each other as well, I think is a really important thing to strive for, and part of why these sorts of partnerships are important. And I want to invite Liz to add on anything that you think might be helpful to mention here.
Yeah, thanks, Christine. I mean, I think that it can be really overwhelming to figure out sort of how to enter into this space. And so I think I would echo really what Christine said, right? None of us is an island. No one person or one organization can or should really pursue policy change on their own. We have to have collaboration, and I think relationships really are at the core of effective policy change work. And so figuring out who your friends, allies, companions are in this work, building relationships with them, figuring out what kinds of coalitions or existing efforts have already been active in your community, and figuring out what kinds of skills and expertise you can bring. I think doing an assessment of your own power and position can also be helpful, right? Like if you're working at a public health department, or if you're working for a community-based organization, or if you're a person that has lived experience, thinking about what is your expertise, what are your relationships, what are the networks you might be able to leverage in this space, and step into the power that we all have, right, and can leverage in a policy kind of space.
Mhm. We had another question here, which is, are there any best practices for managing pushback to these policies? And are there any key messages that you would like to recommend, and welcome either of your thoughts on that?
I'm happy to start, and then we'll invite Liz to chime in again. This is very hard work. And I feel like, when we move through, when, we were moving through our research and having conversations, it became really clear, this is a policy space, I feel like, where you have many, many, many forms of stigma kind of coming together and creating challenges, political challenges. And so naming that, and I want to name that, it's hard. And that is, there's no real way around that. And it's very long-term work we're talking about undoing, decades of harmful policy. And the progress isn't going to be linear. It's important to think about how to sustain, long haul partnerships, coalitions, building trust, celebrating small wins. But I think a concrete thing that I like to point to is the importance of leaning into evidence-based policy, and having that be a North Star. And so knowing, at the same time, the evidence itself is not, going to convince everybody, but that is like a concrete thing that we can lean into, is, the reality of, what policy measures, are supportive of health and which ones are not, and having that be, a real, having that really, root you, into the ground in the face of, political opposition that may be, not as rooted, in the realities, of the evidence. At the same time, we know there's also, the political dimension of it, and power building, and everything we've been talking about already. And so I think I kind of think of it as two prongs. There's the coalition building, power building kind of aspect of this work, for managing pushback, and kind of the realities of how highly politicized this space is. But I think also at the same time, really leaning into that evidence-based policy is really important, because for a long time, a lot of these policies we're talking about undoing just simply don't have that evidence base. And so that is really the to me, like, the blunt facts of it. And that I think is, there's power in that. I don't know, Liz, what else? I want to invite you to share any thoughts coming up for you as well.
Yeah, thanks for kicking us off, Christine. And I think this is such a hard question. It's really like at the core of this work, and many of sort of the wins that have been achieved on policy have been really hard fought, and folks have worked for many, many years, right? So it is long haul work, and there's no easy answer to sort of responding to pushback. But I would name, in addition to sort of rooting in evidence base and relying on the research, I think pairing that with personal stories that really humanize people who use drugs, and humanize the needs that exist in our communities can be really powerful as well, right? I think that can be a good strategy in terms of building messages that really resonate with folks, is to really honor the dignity and humanity of folks who are affected in this work, and center their leadership and their voices to the extent that folks want to share their voice. The other thing that I would share here is, really when there's pushback, I think understanding what the specific source of that pushback is, and maybe conducting outreach and building partnership and having conversations with folks who might be reticent to support whatever your proposal is, to see if there might be some education or some additional perspective that you could provide, and working from there, right? Because this work really is local, and there might be really some specific concerns in your local community that you might be able to address and find common ground with initial opponents.
I wanted to continue on this thread because, in my own experience as an advocate and working in policy change, you often feel like the end of the journey is establishing the policy. But of course, we recognize that implementation is so vital because you can also then, of course, you bring around the change that can be transformative, but it also can then result in pushback, right? When you see the impact of the policy change. And we had a comment come in, one was from an anonymous attendee, which is, what would it take to translate effective implementation of policy change to other communities? And of course, that evidence base that you both just referenced is critical in that. And then related to that, which is, what partners do you need to have on board to implement these policies? And I know we've got about 6, 7 minutes left. And so I'm wondering if we could briefly answer this question around implementation, both translation to other communities and the partnerships that are needed for implementation before I want to move to my final question.
Yeah, I'm happy to at least take on part of the question about, I think, partnerships that are critical to implementation. I think we've said a couple of times that it's really clear that engagement with people who use drugs needs to be really central at every stage of the policy process. And I do think that effective and equitable implementation really begins with effective and equitable policy design. And so bringing those folks in early and often, even before a policy is passed or enacted, I think can be really critical to avoiding unintended consequences and making sure that something works on the ground. In addition to those folks, there's lots of institutional partners, important partners across government in public health, human services, child welfare, sometimes in corrections. And it's important to engage those folks early and often as well, right? I think you can't bring people on board once a policy has been fully developed or passed. You should consult them and bring them on as full partners to the extent that you need to in the early kind of visioning and ideating kind of phase of that process. Yeah, and I would say too often the folks that are responsible for implementing a policy don't get engaged in the design phase. And so if you're going to pass a policy to ask school nurses, for example, to implement naloxone training and manage naloxone access at a school, you should bring in those nurses and school personnel in the design phase to make sure that they have what they need in terms of training capacity and other supports in order to implement the policy on the ground. So that's what I would say as far as partners.
Any thoughts to add, Christine?
I think one thing I had really wanted to mention, if I had the opportunity during Q&A, and it seems like now is my chance. And I think we may have touched on this, but I want to really underscore it, is the importance of not just implementing policies, but the importance of evaluating them once they have been implemented and thinking about that evaluation process as part of the policy design. And so when we talk about, partners, those partners may also include, who do you need to work with to evaluate this policy once it is enacted, to make sure that it is continuing to have the impact that was intended, because we know full well the best intentioned policies do not always have the intended impacts. And when we're working in this space where there are new adulterants, it feels like I don't know, every other week. That's probably an overstatement, but there's new dangers so frequently that there's new challenges all the time, and the political landscape is constantly changing as well. And that is just something I really want mention as part of answering to this question. And I think just like some really practical notes about like translating policy to other communities. I think something we think about a lot at ChangeLab when we do policy research is identifying examples of where policies have been successfully enacted in similar places with similar political and legal landscape. So I would say if you're like trying to identify, you know, what is a good example of something that's done somewhere else, that's a helpful filter. And then, you know, I would say, you know, try to have conversations, you know, with who was involved in making that happen, and ask them, you know, about their challenges and just like, you know, what worked, what didn't. And I think that's my really you know, again, kind of in the spirit of starting out, that is how we start often when we do policy research. And I would say, you know, that is a strategy that I would kind of just offer as food for thought. And thank you for the question.
Well, no, absolutely. And I do have one question for each of you. I know we've got 5 minutes left. I want to just acknowledge a comment that came in the chat from Mary Matos Gonzalez, which was appreciating you all for the presentation and resources. You mentioned policies to expand medication for opioid use disorder, but didn't mention policies regarding contingency management, the psychosocial interventions considered to be the most effective treatment for stimulant use disorder. Given the significant increase in fatal overdose due to concurrent use of opioids and stimulants, has there been consideration into including CM policies in your recommendations? I don't know if we actually have time to answer that here, but maybe we can do that offline. It's an important question. So I do want to just move now to, if I can, though, unless you want to answer in the maybe a chat or other resource. But I want to appreciate both Christine Camilleri and Liz Olson. Liz, who's a senior policy analyst at ChangeLab Solutions, and Christine is a senior planner at ChangeLab Solutions. Just an incredible resource. And in closing, maybe I could ask you both, because everything we do has to embed equity. And I'm wondering if perhaps you could address, how can our audience always be mindful around centering equity in their approach to implementation of these policies? And I'd like to ask you maybe each less in a minute or less, given the importance to that issue. I think that's heartbreaking to me, but maybe you could emphasize that as you close out and before we move to the agenda. Liz, maybe first, or Christine, whoever wants to jump in.
Yeah, I think I feel a little overwhelmed by our lack of time to really address this. But I think, you know, one I guess to maybe share one thing that's maybe quick is to look back as well as looking forward, right? So I think when we consider how to kind of structure policy and what kinds of interventions we want to pursue, it's important to think about redressing past harm as well as preventing future harm, right? So if, for example, your community is interested in pursuing an effort to decriminalize drug checking equipment or decriminalization of possession, it's important to think about how do you also build in a process for expunging criminal records, right, for offenses that would now be legalized. So it's important, I think, to think about what has been the impact of law and policy, and particularly law and policy that characterize the war on drugs on Black and other communities of color, and how do we counteract those really harmful impacts. And so I think that that's one thing to think about, is sort of redressing past harm as well as preventing future deaths.
Thank you, Liz, and appreciate you again for joining us today. And final word from Christine. Any thoughts to add in terms of what Liz noted? And we have like 2 minutes before we adjourn.
Definitely think, and just, you know, just adding on to what Liz mentioned, I think, you know, one thing I'll say, other than, you know, what we've already mentioned about really making sure you are tailoring policies, you know, for your specific community and its needs, also taking into account, you know, the groups of folks who really are highest at risk of overdose. And in the guides, we identified those as people who are currently or formerly incarcerated, people who lack stable housing, or who are pregnant or postpartum, in addition to Black, Indigenous, and other people of color. And so making sure, as Liz mentioned, you are looking backwards and forwards and looking at the specific needs, you know, in your community, and making sure you're prioritizing people at highest risk of overdose. And I think just one lesson, I think or one, principle that really I think bears mentioning. That's a harm reduction principle, is making sure that you um, meet basic needs, boost protective factors, and do so in a manner that honors dignity and choice. And so there's so much work happening already, and I think those are really important lessons to kind of bring into the policy and legal space as well from harm reduction. And so I think that's what I'll wrap up with. And thank you so much for the question, Matthew.
Christine, a wonderful note to end on, and I'm grateful to you, both you and Liz, for your leadership and all of the leadership at ChangeLab Solutions. As moderator, it's been a great pleasure today to facilitate and moderate this conversation, and I've just been so grateful to hear about these incredibly valuable policy guides. Grateful to the National Overdose Prevention Network and Dialogue for Health, and with that, it's not my turn to thank all of you, the audience, for joining us. And again, thanks so much to Liz and Christine for joining us, and for the staff for their support in facilitating and organizing today's event. And we'll see you at our future events. So thank you all. And with that, we will adjourn.